Good evening, everyone. Welcome to the University of Michigan School of Public Health Graduate Prospective Student Discovery Series. I'm Mary Beth Carroll, and I work as the Assistant Director of Student Affairs within our Office for Student Engagement and Practice. My pronouns are she, her, and hers. I hope that you enjoyed the introduction video sent in your reminder email from Dean Bowman. If you haven't had a chance to take a peek, I highly encourage you to see our message from him for our prospective students. This evening's programming is going to focus on our fully online population and health sciences programs. Now, more than ever, the world needs public health, and public health needs people like you. Tonight, we'll talk about the field, program designs, and what life is really like at Michigan Public Health. During our programming, you'll have the opportunity to engage with staff, faculty, as well as a current student in one of the online programs. We'll leave time at the end for you to submit questions via the chat box, but please know that if you have individual questions for our team, you can always reach out after tonight's session. And with that, we'll be sure to share our contact information with you too. Here at Michigan Public Health, our mission is to pursue a healthier, more equitable world through education, research, and action. We work as a team with compassion, innovation, and inclusion to create a meaningful and lasting impact. You know, when you think about it, public health really is all around us. It's the quality of the air we breathe. It's the flu shot that you're probably getting at the pharmacy right now. It's the ethics of genetic testing. And it's the creation of policies that govern our healthcare system. If you hear about something in the news, it's likely that there's a public health angle to it, especially now more than ever. So here's the common denominator. Everything that we do in public health is about improving the health of people, but at a population level. Now, as a graduate of the University of Michigan, you'd become part of one of the world's largest alumni networks. This degree will take you no matter where life will. And at Michigan Public Health, our students are able to join a top-rated program that has a long-standing tradition of excellence. Our history started in 1941 when the school was founded. Believe it or not, this is where Blue Cross Blue Shield was created, the National Sanitation Foundation was founded, where even the first Earth Day was held, and where the flu mist was invented, and the polio vaccine was proven safe, potent, and effective. The University of Michigan and the School of Public Health have consistently earned top rankings for the programs and the resources that we offer. At this time, I'm going to turn it over to Dr. Sharon Cardia. She's our Associate Dean for Education and a Professor of Epidemiology. Thank you so much for taking the first step to learn more about our great community and our school. I wish you a great evening ahead. Thank you.
Thank you, Mary Beth. So as Mary Beth said, we're going to spend the next maybe 30 minutes going over our programs and degree options and you know, some of the student experience as well as how to apply and tips for applying, and then open it up for questions. Today's event, we've got Lisa Garber, who's our program manager for the online program, Levi Rose, who's a student affairs support, and then we have one of our students from the first cohort, Kamal Gavil, who's basically going to tell you like it is in the program. I've been really lucky to be surrounded by the Michigan team and helping to build this online degree program. We've worked with the Coursera team in order to make it, you know, basically something that everybody from across the world could enjoy. Can I have the next slide? A big thing that I think most people who are interested in public health or population health find is that it's not easy to define. You know, what is public health? And, you know, if you think about it in the biggest sense, it's the discipline that is all about trying to discover why people get sick. So that's the science part. And then it's the art of trying to figure out how to prevent disease. So once you figure out why people get sick, then preventing it becomes the number one thing that public health does. And as we've gotten better and better at that, it also means that we're trying to do a better job at like aging and living with the chronic diseases that we have. But by and large, it's really about identifying what are the environmental hazards, what are the lifestyle issues, what are the structural determinants, what are the policies that are actually giving rise to, for instance, polluted air or unequal education and income distributions that are always associated with, kind of having worse diets or worse working conditions. And so basically worse health outcomes. The University of Michigan has been a leader in public health for decades. We have 6 departments: epidemiology, environmental health sciences, biostatistics, health behavior and health education, health management and policy, as well as a relatively new department dedicated just to nutritional sciences. Today, we're going to talk about one program that is school-wide, which is the Population and Health Sciences program. Go to the next slide. Yeah, what is public health? What is population health? So population health is not just public health, but also healthcare, and it's community health. It is really the science of looking at how do communities rank and navigate the health of their constituents. And it could be a community in the sort of little sense, or it could be in the big sense in terms of nations. How do we measure the health of a population? And then how do we understand who within that population is getting sick and why? And whether or not those individuals differ by key things. So, for instance, what is it about the policies that we might have at a nation level or at a regional level that actually have made it more difficult for people to live or to not be affected by their environment, or for instance, infections. I mean, certainly we're seeing right now with the pandemic that the virus is following different social lines, and it cuts across many age groups, but it's not affecting everybody the same way. So population health is really now almost like trying to assess how a population is healthy or not. What are the factors that are giving rise to that population's ability to navigate those health issues and to respond? And basically, at a population level, responses are policies, practices, interventions, and cultural norms, and changing those cultural norms. Next slide. So many students that are interested in population health have, first and foremost, a passion to really want to make the world a better place. And this passion can take many different forms. So, for instance, here are 2 current students in the program that I refer to as the Chris's, because they're both Christophers. Chris Rudsky and Christopher Crow come from very different angles. So Chris Rudsky is a nurse, and he's working at that individual patient level, but he came into our population and health sciences program because as a public health professional, he really could see that he'd be able to help people at a community level prevent getting disease by, looking to health promotion and health education as major elements of what makes a difference when people are faced with either, healthy choices, not healthy choices, but schools being faced with choices that they get to make about nutrition and exercise. Or you can think about cities and urban planning. All of that falls underneath of population and health sciences. But then Chris Crow, he's got basically this clear passion about socioeconomic factors and an understanding that people that are at the lower end of the social economic spectrum don't have the same care, don't have the same benefits that come with income, race, education, and other factors. And so that is really driving him. And I just talked to him, and he's taking this MPH and he's applying to PhD programs. So these are just two examples of the kinds of ways in which you can come from different sectors. The healthcare sector, or Christopher Crow is working at home, and this is his next step in his own sort of career dream, where he wants to go. But we have individuals from all different sectors, everything from the military to the, as you would imagine, physicians and people in the healthcare professions, but then also people that are consultants and, doing work within the health sector at an industry level. Next slide, please. Okay. So we just started an MS program as a sister to our Master of Public Health. The Master of Science program is a little bit different than the professional degree, the Master of Public Health, because it's more focused on the skills. It's thought of kind of as a research degree, a sort of science oriented, in the sense of how do you actually take a problem and pull it apart and do a research project. And it doesn't mean that, this MS is just going to be research only, because public health is full of kind of real problems that real people have to solve. But it has more of an emphasis on some of the analytical skills and quantitative skills, and it has just a bit more of an emphasis on those kinds of physical sciences. The Master of Public Health has been around for a long time. It's a professional degree. It's recognized as a practice-oriented degree. Not that MPHs can only do practice. Many of them go on to get PhDs and are in academia or in other non-practice settings. But by and large, it's the thing that says, I've got the training to think about populations, to understand the structures, whether or not it's social structures, it's the structure of the environment, or policies that are practical. And so where the MS has a research project as its culminating experience, the MPH has a practicum, some applied practice projects, and a capstone, where it's a chance to integrate across the competencies that have been gained throughout the courses into a project, a grant application, a community health needs assessment, those kinds of things. So these two degrees were developed so that we could serve basically a wider audience. And I think that as you go further and maybe ask questions, we could do a better job of trying to understand what degree might be best for you. Um, Right now, because of the accreditation standards, the MPH can only be offered domestically, but for all intents and purposes, we'll talk to anybody at any time about your interest in the programs. Next slide, please. One of the hardest parts to convey if you don't know a lot about public health is what is in this kind of degree. And we focus a lot within our courses on developing critical skills for the workplace. So everybody who has a background in public health at some point needs to be using data, because this is a data-driven profession, and it's a data-driven art form. So we often put a big emphasis on how do you collect data, analyze it, report it. But then a big part of public health is getting the word out. So there's an emphasis on health communication, and what we've got in terms of making sure that this is the best science for people is a real emphasis on what we'll call epidemiological methods. So these are the methods that allow you to accurately measure disease in populations. You can't just measure it in a single individual. You actually have to have a design to make certain claims about knowing the health of a population. And epidemiology is that science, the science of studying the distribution and determinants of disease in a population. But of course, a part of public health has got to also be the health of people because of their care settings. So quality and finance and healthcare settings has traditionally been a part of our health management and policy department, and we have an elective series that focuses on some of that. Um, if you think about what makes change, as I said, policies make change, but also interventions. So we make sure everybody has a view and an understanding and some experience in program planning and even in program evaluation, because how do you make a population healthier? You've got to have a plan, and you have to see, how can that plan be better? When we think of the next layer down in terms of like primary causes, a lot of emphasis within our thinking has to do with the environment. And this can be social environment, physical environment. There are many ways to describe environment. And I would even say, I'm a geneticist, that the environment is the main thing that interacts with our genes to really determine whether or not somebody gets sick. The last critical skill I put in here is just a little bonus because we've got such a great nutritional sciences department, and they've put together a great elective series on maternal-child nutrition assessment. They have more than that, but this is a specialty that I think for those people that are interested is a real bonus of the program. Next slide, please. So if you think about what we've been talking about in terms of this Masters of Public Health or Masters of Science, often what I think we do the best is try to get the core to be solid for everybody, but then elective series that can match what you want in terms of your career goals around getting this degree. So there are some of the elective series that are set up to really help you if you're interested in either pursuing this kind of work within healthcare, or for instance, if you want to take this degree and move into more of an academic kind of research environment. Certainly, there's a lot of work that can help you within sort of the commercial, nonprofit, or consulting areas. They're just like access to big tools and big data sets that would be very helpful in navigating this really, I'll call it data complicated territory that we're in. It also can be very good for people that are interested in working in government, and we've got federal government here, but local and state public health are really the big part of the workforce in the United States. And so there's a lot of what we do that directly translates to the needs in those sectors. And then last but not least, there are some individuals that are interested in this because of their role in the pharmaceutical sector, because pharmaco surveillance and vigilance and following up basically um, the distribution of treatments and therapies and their impact on people has become pretty much a population health pursuit. And so a lot of the tools that we and skills we go over in the classes are good within the pharmaceutical sector as well. All right, next slide. So what is the program itself? This is basically the details and the brass tacks. Both the MS and the MPH in Population and Health Sciences are offered 100% online. Each of the degrees is 42 credits, and they can be completed in 5 terms. So what do I mean 5 terms? We have fall, winter, and spring, summer of the first year. And then we have fall and winter of the second year. So it really is designed to be doable in a little bit less than 2 years. It does take a lot of, I'll call it focus. We only put in front of you 1 or 2 classes at a time, but the expectation is about 15 to 20 hours per week. And that includes everything. So that's watching the videos, it's doing all the readings, it's doing the either group work or going to the Zoom session. So it's all inclusive. So there's no extra hours here. A lot of people are doing this by and large on the weekends and in the evenings. And while they're going to tell you that it does take a lot of investment, it's doable. What else? Another big thing that we get asked all the time is, okay, what does it really cost? And it basically is on a per credit cost basis. But when we take those 42 credits and we sum it up for those 2 years, a Michigan resident's going to pay about 43,500, and a non-resident is going to pay $47,500. So that's about $1,000 a credit, maybe a tad more, but it's in that range. And I think that you can expect it to stay in that range. Let's see, what else? When we put together this program, we tried to figure out a way that would appeal to the most people, representing the strengths of the school. So the very first year is really focused on the core. So these are the core skills that you need in data analysis, statistics, epidemiology, program planning, understanding social determinants of health, understanding healthcare systems and the U.S. Public health system, understanding environmental health and environmental policies, as well as population health and health communications. With that set of tools in your toolbox, we then open it up and you can pick from, I think right now we have something like 40 different electives, and they're bundled in what we're calling elective series that would allow you to get a depth in a discipline or an area in that discipline. So for instance, we have 2 elective series in epidemiology. One is in the core epidemiological methods. It includes classes on policies, as well as how do you figure out whether or not something really causes a disease, and analytical software called SAS, as well as an introduction to the big data sets that are used in a lot of the core national assessments of health. But the second elective series is all on spatial epidemiology. So that's the study of, where are people getting sick? Are they clustering? Are they changing in such a way that you can now associate it with, let's say, a virus spread and going back to school? Or, for instance, an environmental plume in the water supply or in the air. So spatial epidemiology is putting another whole layer of information at your disposal. And that series uses, for instance, the programming language R, and it allows you to be able to figure out, how do you get the data, plot the data, analyze the data to make inferences about what is happening within different geographical scales and timeframes. Really, really important for being able to detect clusters of disease with confidence and discern whether or not it's just a random cluster, or really if there's something going on in a community. I talked a little bit about the last kind of major capstones and integrative projects, and the ways in which those cores and electives then culminate in 2 applied practice projects for the Masters of Public Health and an integrated learning experience that is basically a written product that integrates about I'm going to say 5 or 6 different skills on a topic of your choice. Could be even working in concert with your current job or your current dreams and loves of population health science. We want those projects to be personalized to you, to matter to you, and to be of benefit to you. So right now we're having a ball working with the students as the applied practice projects come in from all different directions from across the country, serving many different community groups that have asked for the students' help, but then also some that are much more local and personalized to their employers. The MS program takes a little bit of a different slant, not as focused on the practice partner relationship and applied practice partners, but really now takes a sort of single question and teaches you how to approach it through a research lens. How do you take a good chunky question like, is there an association between air pollution and heart disease? We have many great data sets that are filled with many layers of information on thousands of people. And so we'll set down some of these research questions and work with you to find a good research question that's of interest and to actually help you move through the process of how do you take a big question like that and find the right data, analyze it, make inferences, and weave it into the current knowledge that we already have using, big reference databases like PubMed that has curated thousands and thousands of articles on air pollution and thousands of articles on heart disease. So we'll help you navigate that and have that culminate in basically a research report. And some of those might even turn into research papers that could potentially be published. I spent an awful lot of time on the program overview, I think because I love it. I think it is got this perfect mix of breadth and depth, and it is adaptable to people. So this is not a one size fits all. This is really, you can kind of make your own adventure. Next slide, please. Oh, yeah. I mentioned this earlier because it's one of the key features of both of the MS and the MPH is that these are 100% online. All the videos are online, the assignments, the readings, and the live classes. Every single class will have a weekly Zoom meeting that you'll work with your colleagues, you'll work with the faculty. Often it is working on the problems, sharing the information needed for whether or not it's a homework, a group project, an exam, those kinds of things. And this 100% online system allows people to basically adapt it to your lifestyle, your work needs, and those kinds of things. Even to the point that we've had some of the students who got deployed to different nations during the program and were able to keep going. So don't let your own mobility sort of scare you. This program is designed to go with you.
So at this stage, I'd like to just take a quick moment to invite Kamal to introduce herself and share a little bit of information about how this all works, and how it all really feels as a current student. So Kamal, would you join us and tell us a little bit, maybe first, about what motivated you to join Population Health Sciences this time last year?
Sure, Lisa. So my decision was actually quite practical. I needed a program that would fit in with my work and life, and I would still be able to maintain that. And I also wanted to advance my career, and this was a great option for me. I think in hindsight, I became a lot more passionate as I started working through my coursework, and I started seeing the connection between school and work, and really starting to enjoy that. So that's really what motivated me to apply for the program. program.
Fantastic, thank you. Could you tell us just a little bit about your typical schedule? For example, what does a typical, if there is such a thing, a typical week look like for you?
Sure. So typically, and it varies quite a bit, but typically we have class for about 2 hours, 2 to 3 times a week, usually between 7 and 9 p.m. And then I try to reserve either Saturday or Sunday to do all the assignments related to the class. And it's as flexible as you want it to be. So I'm sure there are people who are able to manage to get everything done on the weeknight, so they have a free weekend. But it's really built around your life and the way you want it to be.
Yeah, it's funny that you mentioned that. I do get emails at kind of all hours, and they seem to be the same for most students. Like some of them email, every Tuesday at 3 a.m. That's when I hear from them. So I think it really does flex with a lot of individual schedules there. So tell me a little bit about how you connect with your peers and how you interact with faculty throughout the program.
Yeah, I'm actually quite surprised. I thought it would be very difficult to build connections online, but I've made some really, really good friends through the program, so I'm really excited about that. We use a lot of technology to our advantage, so we use systems like Slack, we get very good at Zoom, and then if you need to contact someone, there's always email. So it's been great connecting with everyone. And of course, professors are always available. A lot of them hold open office hours that you can attend. But even if you email them on weeknights or over the weekend, they completely understand and are very responsive to whatever you need.
So are there any skills or tips that you might have that really help you succeed in this program?
Yeah, and I think once you start building your own list of things that you need. But one thing that really helped me is having my own workspace, especially when the pandemic hit. It's just nice to have your own space to kind of study and not have to worry about other things. But other than that, don't worry about technology holding you back. There are many people we all have varying levels of technology experience, but as we get into the program, we definitely learn as we go along.
Great. And finally, what university resources, so anything along the academic, career, or wellness lines, do you find helpful as you persist through and into your second year of this program now?
Yeah, the library actually has a lot of amazing resources that we get access to. We get a lot of technology resources that are quite helpful as well. And then, of course, we always have our advisors available to us at any time.
Thank you. So if there are other questions for Kamal at this time, please feel free to type them into the chat box. Otherwise, we can continue on through the presentation here and take additional questions at the end. But if you have any questions that are top of mind right now pertaining to the student experience for one of our second year students, this would be a great time to type it into the chat box. I'll pause for just about 30 seconds here to see if those pop up. I think we're in good space here to go on and talk a little bit about the application process, but feel free to, if a question comes to your mind, we will be doing Q&A in just a few minutes here, and so you can type them in at that time. Oh, I apologize. There's one question here, Kamal, before we move on. Would you talk about your involvement in any programs at the school? So any kind of student organizations or events or co-curricular activities that you've done?
Yeah, I'm not as involved as I know some of my other students, other fellow students are, but I did get to participate in solving a challenge for the COVID-19 with a few of my classmates, so that was really fun. It was through the New York Data Science Academy, and basically it was a challenge to come up with a solution to surveillance data for COVID-19. So things like that, you do get to connect with your friends and build something together.
Yeah, that was a really, really cool project to watch, actually. I think you're underplaying it a little bit. Kamal's group made it to the top 10 finalists of that competition. It was quite a feat. And we have a Pursuit article about it where you can read a little bit more about that particular endeavor. It was quite a wonderful presentation that you all delivered. One other question, if you don't mind, what was the biggest challenge you experienced and how did you overcome it?
Yeah, I think motivation, you really need a lot of motivation to be in this program. It's a lot to manage your work life, your regular life, and then school on top of it. And I think what really got me through dealing with motivation to continue with my schoolwork were my friends that I made in class. So we have study sessions on our own about once a week, which is really nice and just keeps motivating you and seeing that, okay, other people are struggling too, and you can help each other out. So that's been wonderful.
Fantastic, thank you. I think that wraps up our current questions at the moment, but keep them coming. So at this stage, if this program is starting to sound like a good fit for you, I think that we should spend a little bit of time demystifying the application and admissions process. I apologize, I just realized my video is off. You might enjoy having access to a human. So we are currently accepting applications for fall 2021 admission. And due to the requirements around our applied practice and integrative learning experience, which Dr. Cardia mentioned earlier, in order to be eligible for the MPH, applicants must be US citizens or permanent residents. However, the MS application is open to applicants from all over the world. We have a priority deadline of February 15, 2021, and that's the point at which we really start reviewing applications for scholarship consideration. So if you want to be considered for our school scholarships, it's really to your best advantage to try to complete your application by that priority deadline of February 15. However, we're going to continue to take applications and do all of our review, including scholarship consideration, through June 15. Note that the MS and MPH programs do have different application systems. So if you're applying to the MS degree, you'll use the University of Michigan Rackham Graduate School CollegeNet application. So we'll share these links, don't panic, that's a mouthful. But when you go to apply to the MS program, you'll notice that you're on the University of Michigan's website through Rackham Graduate School, and the CollegeNet application will open. And then when you go to apply to the MPH program, we use the SOPHIS app, which is it's a centralized application service for all schools of public health. And so you'll see a wide variety of programs there. So it's MS application goes on the University of Michigan's website, and the SOPHIS application for the MPH is a centralized app. So you'll open up the relevant system, whichever one you're applying to, and start to fill out the application form with just some basic information about yourself. You'll also need to provide official transcripts from previous colleges or universities, a statement of purpose in which you talk about your preparation and motivation for pursuing population and health sciences, a personal statement that addresses your unique backgrounds or experiences in your journey to graduate school, a short quantitative experience statement, which is new, and this should summarize the strength of your quantitative and analytical skills related to either academic or professional experience, your resume or CV, 3 letters of recommendation, and if English isn't your native language, language exam scores. So you'll notice that for this very current application cycle, there are no standardized test scores required. That means no graduate record exam or GRE is required this year. So Dr. Cardia, could you tell us a little bit about your perspective as director of these programs? Can you tell us what makes a strong application from your perspective?
Certainly. I mean, the number one thing is there has to be a sense that this is a field that you want to go into. So a passion for public health or population health or community health, for helping people, and not just sort of one individual at a time, but really this sense of almost like, how do we help the world? And many of us actually have it. So I don't want to sort of say it's sort of something specialized, but it really does keep you moving through what is a really complex and complicated field, and especially in this time period where there's a lot of unrest and turmoil. It's great to have I'll call it the clear signal that you're going to be working with somebody in your classes that has this kind of sense of, okay, I want to make a difference, and I want to make a difference, wherever, being able to tell that story. Another thing that makes a strong application is a good academic background. And we recognize that not everybody is going to be, coming to us with a recent academic background. But, we've seen over time people successful in the program have a background in biology, psychology, sociology, business, math. I mean, it could be a wide range of things, engineering, something that actually gives you either a systems view, a biological view of what does it really mean to be either healthy or to have systems that, would support people being healthy. We do require some very basic things of everybody. You have to have, kind of basic algebra and biology and chemistry, and hopefully some statistics, any kind of math, because population health sciences tends to have a quantitative, as I said, data-driven aspect to it. So it's important to have some of that. It really does help. When we think of a really good candidate for this program, we're also looking to see what they've done. So, what has been the career link or volunteer experience? I mean, did you work in another country in terms of, could be the Red Cross or some other non-government organization, or maybe you were in the Peace Corps, sort of the service that you've done, or aspects of your current job that have either a population kind of view or actually a health care or a health sciences background. All of those kinds of things are really good for demonstrating that you're kind of already a part of the public health family, because any of those social service agencies or public health agencies, or even things within government, means that you're thinking about people and how do we make the world better for people. Another thing is putting those elements into a statement of purpose and the personal statement. They're two different things that would allow us to actually see, oh, we're a fit. I'll give you an example of something that is not a fit. We had somebody great academic background, but what they really wanted was a degree in clinical research methods. So how did they do research in their clinical practice? And that's not what this program is, because we are much more about the health promotion and health education, or the environmental and social determinants of health, and that population view of community health. So there are other programs that do the clinical research within the MPH, but not this one. Another thing that makes a strong application is good letters of recommendation. And what does that mean? It means that you really want to pick somebody to ask who is got a professional connection with you, and that either was a part of these service career or volunteer experiences, that they can speak to your ability to do the program. This means that probably not family and friends. They know you in other ways that are about your good qualities and values and things like that. But we're really looking for more of that professional, out in the world assessment of your character and ability to do this work. Another thing is that we really would appreciate if they were on sort of more formal, either letterhead, or had some of that sense of this is a representation of you from their professional experience perspective, and having that information about who they are. How do they know you? Because of the way in which it can be hard to get a letter of recommendation that is, how do I want to say this, credible, if what we get is 4 lines in an email that says, Sharon is great. I've worked with her, and she's lovely, and you'll really enjoy her. I mean, that doesn't give us enough information to say, you know, is she organized? Can she manage time? Is she really always wanted to do this kind of program? And she really has the support of, us as an employer to do this work. Those kinds of things matter because, as you heard Kamal say, there's a lot of work, and you need that sense that, oh, this person can do this. I think another thing that we might look for is whether or not you are really ready for online learning, because it takes a very strong internal drive and time management to do this. So those kinds of things can be in your statement of purpose or within their personal statement that we're looking. It's like, oh yeah, this person can do this. Kamal, do you have any tips for students? I mean, you don't have to, but it just seems like if you did, they might want to know it.
Yeah, I think just being yourself and showing your passion. Make sure you do your research and understand what the degree is and kind of plan for how you envision the degree to help you in the future.
Right. Maybe last but not least is, how do we do the actual application review? It's a holistic process. So we don't have just a single, like, we're not putting you through some kind of single rubric that really is looking at everybody in terms of their own complete portfolio, because we know we've got people that are coming out of sort of jobs and situations where they haven't been back to school in a long time. And we've got individuals that just finished, for instance, their undergrad. We have the whole gamut within these programs, which is pretty nice. Lisa?
Great, thank you. So as we're looking ahead to fall 2021, there's quite a bit of time between now and then. And so we wanted to talk just a little bit about the things that you can do between now and then, in addition to submitting your application. So once you've prepared and submitted your application, our admissions committee is going to spend a few weeks reviewing your material and making a decision. Our admissions team will notify you of their decision via email. And if you're admitted, you're going to need to let us know whether you plan to matriculate for fall 2021 or not. And there's a little bit of a decision process to be made there. So Kamal, I actually wonder if we can start with you and have you tell us about some of the factors that led to your decision to enroll in this program.
Yeah, sure. So a big part of what I loved about this program is that it was 100% online. It really helped me balance my life and my work schedule. That was a big factor for me. And then I actually did my undergrad at University of Michigan, so I knew that I had amazing faculty and great resources that I could rely on. Because it is a big time commitment. You do have to be ready for that, but it is all manageable in the end.
Thank you. Dr. Cardia, do you have any other tips for students that are trying to make this decision or possibly comparing graduate programs?
I would say that if you really are at the sort of juncture where you're like, is this right for me or not? Give me a call, shoot me an email, and let me have a conversation with you, because I can often answer your questions pretty rapidly. And from there, you can make a much more informed decision. And, while I certainly am invested in having, as many great students as we can in the program, I also really want it to be a good fit. So I'm a straight shooter, and I'm happy to have a conversation with any and all of you.
Thank you. That's a generous offer. I would encourage everyone to take Dr. Cardia up on
It's
that.
the fun of being in this position, is all the great people I get to talk with. You would be surprised at the number of people I've talked to. It's always great for me.
So I'll chime in with another big factor that always comes into consideration when making a decision, and that's funding. So all admitted students are going to be considered for School of Public Health scholarships. And so, like I mentioned earlier, getting your application in by the priority deadline of February 15 gives you the greatest chance at consideration there, because when we expend all of our scholarship dollars, when we run out, we run out. So get your application in by February 15, but you don't have to submit an additional application to be considered for that funding. Last year, over 40% of our admitted online master's students were offered scholarship funding towards their degree. And many of our students also benefit from tuition reimbursement programs through their employers or through US military support. We also encourage all applicants to search for additional funding in a number of ways. So one is to submit the free application for federal student aid, which is the FAFSA, as soon as possible, and that will help you apply for federal grants, work study, and loans. Two is to connect with the Office of Financial Aid at every school to which you're applying. So University of Michigan has a fantastic Office of Financial Aid that works with prospective and current students, and every institution should have a comparable department that you can talk to. Three is to explore scholarship search engines curated by the Association of Schools and Programs of Public Health, which is commonly referred to as ASPPH. We'll share that link. They have a great set of search engines that you can use to search for additional dollars. And then finally, all of this information is outlined on our website under our tuition aid page, which we'll share in the chat box here. And then you can further explore these and other suggestions. And finally, there's still a lot of time ahead of us after making a decision and finding some funding for your degree. So I wonder if Dr. Cardia or Kamal, if you have any recommendations that could help students hit the ground running for fall 2021, to be prepared for that first course out of the gate when you take Principles of Epidemiology or Biostatistics, which comes at the end of that first semester. Any tips for preparing to enroll in this program?
Mom might be better than I would be.
No tips in particular. I think just be ready for the time commitment for the program. And as long as you're passionate and you're willing to learn, you'll be fine. The program's very well designed, and faculty and staff are very, very helpful.
Thank you. So with that, we have still a few minutes left in the hour, and we'll continue to stay on as long as there are questions. So feel free to type your questions into the chat box or into the Q&A box, and we will go ahead and address them. One is if you could talk a little bit more, Dr. Cardia, I think you would be able to answer this question. Talk a little bit more on the programs that focus on clinical research, and if there are opportunities within this online program to focus some of the elective time or capstone projects on population-based research for a particular disease process.
Mm-hmm. Yeah, I just sent Sarah a response to that
Oh,
because
great.
we do.
Okay.
But let me just say it for everybody, because we do have one residential program that focuses on clinical research. It's in our Department of Epidemiology, but that's for healthcare professional students that are currently in dentistry, medicine, nursing, pharmacy. But we have another one that is called the On-Job On-Campus MS that's offered through our Department of Biostatistics. That is kind of, you come in for several weekends and they have kind of intensive weekends that they work on delivering the material. We're working with them right now to convert it into the online space, but that's probably going to take us a year and a half. But anyway, to the second part of the question, absolutely you can focus on particular diseases and disease processes everywhere from, when people are given a project in a class, often it'll be like, okay, so the project is to create a program plan that, for instance, improves nutrition in order to improve health outcomes. Well, if you, for instance, are interested in heart disease, maybe what you do is you focus in on what is known about diet and heart disease and pick I'll call it a venue like, I don't know, skilled nursing facilities. And so you take that as an angle, and you can keep finding the ways to interject what is your interest area into the work that you're doing. The other part about this is clearly in the capstone or the research project that you get to pick what area that you want to do the work in. And it can be as tailor-made to what your interest area is as possible. We just had somebody who said, oh, I see that one of the options to learn is to write a grant. Can I write a grant and then submit it? And it's like, sure. So we want this to be practical and to be helpful.
Thank you, Sharon. Another question we have in here is if you could speak to the selectivity of these programs. So when we're applying to the MPH or the MS, is one more selective than the other, for example, or could you speak to the competitive nature of applicants to each program?
Oh, I'm trying to remember the statistics.
I can tell you the statistics.
I mean, we basically, I think, overall have something like, I mean, 3/4 of, I think, the people that complete the application who've gone through all of these steps who really want this degree program, we admit. And it's because, I mean, as you can see from what we've said, you really do have to want to do this. And it's not just, you know, kind of a drive-by. And we've found overall that of the people that we admit, by and large, the vast majority come. So that to me means that we're doing a good job of telling people kind of who we are. We're attracting people. And if you feel like you're a good fit for the program, you probably are.
Thank you. Could you speak a little bit to the opportunities for mentorship, for student and faculty mentorship relationships?
All of the faculty that teach within the program are, I'll call it hardwired for advising and mentoring within their domain. And when we think about kind of our jobs as professors, if you have a particular arena that you're really passionate with, so let's say it's environmental health, and the faculty member who teaches our intro environmental health and policy, Rick Neitzel, is fabulous. If you reach out to him and say, hey, I could really use some advice, or could you really help me with blank? He's going to do that. That's a part of what is the, I'll call it job description of being a U of M faculty. It can even go as far as striking up, you know, kind of research collaborations. It depends on what is the right, I'll call it timing and alchemy, because right now is a little tough with the pandemic. Rick is doing our wastewater surveillance in the university, but many of the faculty just know that being with students along this journey is a part of what we're supposed to be doing.
Could you tell us a little bit about the average class size and whether you should expect large lectures or small cohorts?
We've basically been at the sort of 35 to 40. For us, that feels comfortable. You know, it may get a little bit larger, but you know, that actually is kind of the ideal for us, that it allows us to do some breakout sessions and things for, you know, people to work in groups of 5 or 6, but overall um, it's relatively good sized. We don't do large lectures. It's a part of why we've done this online program. All of the material is at your disposal. It's already been recorded, and that's the real content. So the live sessions when we're all together is more spent on, I'll call it, wrangling with the complexities, answering questions, doing group work, you know, really taking, I think, the content and integrating it into what is your own experience or what is the challenge that's facing you in a homework, a project, you know, a capstone, those kinds of things.
Thank you. I think that brings us to the end of our event, everyone. Thank you all so much for your time today. Please do reach out again if you have any further questions. And as you move throughout the application process and the decision-making process, we will follow up today's event with an email outlining the key resources that we discussed and the links that we were sharing in the chat box, and a recording of the event so that you can revisit it if you have questions that you'd like to revisit today. So feel free to email us anytime at sph-inquiries@umich.edu or find us on social channels. And we look forward to seeing your applications. Thank you.
Thank you. Bye.